which is updated hearing screener from Natus. So the working principle and the algorithm is exactly same as the Algo 3i machine what I'm using earlier. Okay, so the machine comprises of a main device, the cables, okay, and then a docking station. Docking station is mainly for charging, okay, automatically be charged, and also any data to be sent to the printer or even otherwise for the PC. Okay, so you always keep, at the end of the day, you keep the unit back docked in the docking station. Now on the cables wise, I'm sure you're already familiar. Okay, we have two sets of cables. One is the ATA cable, what we call it, or acoustic transducer assembly. Okay, so this is basically the cable which gives you the clicks to the baby's ear, right? So red is for right. So in audiology, the terminology always is red is right. So red goes to the right ear and blue is to the left ear. And then you have the other cable, we call it the PCA cable or the patient cable assembly, which has again three connections. The white one always goes to the nape of the neck. Okay, so if I were to show you on the baby, on the nape of the neck, and then you have a ground, which is green, that goes on the shoulder. Always remember, don't try to put it in front. Okay, put it behind, near the bone, near the collarbone or somewhere behind. And then, which is green, that goes on the shoulder. Always remember, don't try to put it in front. Okay, put it behind, near the bone, near the collarbone or somewhere behind. And then the black goes on the forehead, the vertex. So three connections: nape of the neck, shoulder, and the vertex. So now comes the working part. Even working wise looks the same, okay, but the user interface is a touchscreen interface and much faster. So again, you have two ways of doing it. Either I go for a new patient data, okay, and then I add my ID, enter my first name, say suppose I'm just saying, say Gwen, okay, I'm just a name which came up, E-N, where's N? Show me someone, show me N. Yeah, N, okay. N and last name something, enter. Date of birth, maybe say yesterday. So I said yesterday, right? 20, done. So you're ready, right? All it is, say yes. Saving patient data, say yes. Okay. Now start screen. So patient data is fast. So you already saw the difference. There would probably take a long time for data entry. You're already ready. Just start screen and it starts. This remains the same. For example, if the cables are not connected, if the impedance is too high, not up, you will show both as green. The impedance values are still the same. 0 to 8, if you're getting, it's pretty good. If it's 8 to 11, then it may take a little longer time. About 12, the machine says it's too high and you need to work on making it less. You know the term what impedance is, isn't it? Impedance is nothing but is a measure of how good the electrode to patient contact is. If the impedance is low, then the signal conduction is faster. You'll get better results. Okay. So currently I cannot. Let me just try to do it for you. Yeah, you can stop. That's basically how it is. So let me try to. Okay. So procedure wise, maybe you can start recording. Okay. So can I start?
Yes.
Yeah. So procedure wise, I always recommend. Okay. We start from the behind, from the nape of the neck. So put the baby in the prostrate or side position. Okay. There is a new prep gel. Are you using the gel earlier? Okay. So always I suggest take 2 gauzes. Okay. Strips. One gauze, take a little of the gel, put it. Okay. Other one, don't use it. Now the one with the gel, put on the nape of the neck and rub it thoroughly. Don't just put it and leave it. And do it. Apply it and nicely rub it. Even if you may feel sometimes the skin of the baby is reddening. Okay. So put the gel, that's why, clean it. And then when you have the other one is not used, rub it off. So just to make sure you remove the gel. Okay. Once that is done, you have electrodes. Normally, if these electrodes need to be a little warm. So this is a nice temperature. But if it's very, very cold, then maybe you need to warm it a bit. Okay. If it's under the radiant warmer, doing it on the radiant warmer, maybe this is pretty fine. But it's very cold, remember, because warmer it sticks well and it conducts well. If it's cold, it's a normal thing. Even AC generator. If it's cold, it will not. Okay, so just warm it up. Now I'm starting with the nape of the neck. Okay, so always start from behind. I will apply here this way into this purple region. I've cleaned it well. I will remove it. And depending on where you're working from, right? Suppose you're standing here, then you do start from this side. Yeah, apply it like this, as high as possible to the hairline. Okay, if the hair starts from here, put here. If it's coming down, then maybe try to push it up and put it. And once you put it, don't just put it and leave it. Don't do that. Put it, wait for some time. Probably 2-3 seconds. Like what I did. Press start screen. See, now you can see it's all green. So when it's all green, it's all connected well, impedance is less. Any of the sensor comes out, see, we'll say impedance is, because it's come out. Okay. Anyway, put it back. The display again remains the same. You can see two symbols, one of a bell, another of the small baby. The bell is the noise. If there's too much of noise in the room, then it may take a little longer time. The machine may wait till it settles down, then it starts screening. And the other one is the baby movement. If there's too much of movement on the baby, you can see this. So if the baby is moving again, the machine can't distinguish a lot of myogenic activity, right? So see that the room is significantly quieter. Baby is not moving too much. Once that is done, then you can see the two other regions. So this is red is right and blue is left. So this will keep updating. And just like the other machine, it will fill in and give you a pass or a error. So if you do the procedure this way, spend some time, probably spend the 5 minutes here, then your screen will be just probably 1-2 minutes. Just keep it and leave it. No, don't do that. Keep it and at least try to massage it nicely. So spend this at least 4-5 seconds. This may sound initially a little cumbersome, but then later the screening will be faster. I can guarantee that. Okay, this is done. The same process now I'm doing the other side. I take my other ear. I got the baby's hair, clean it up nicely. Yeah. Maybe I should have put this before. I think make it a practice to put it before. Okay. Yep. So this is done. It stays in place. And last of all, now go for the forehead. Last sensor, I'm going to take it and I'm going to apply it and on the forehead and hold it. Okay. Now currently, to help you see the screen, can someone hold? This whole system. Thank you. Okay. Let me try because it will not go. I'll have to make. It will be faster, but don't do it and leave it. Okay. So this is done over here. Then we go for the second one. We repeat the same process. Take the gel on the shoulder, rub it off nicely. Take the other gauze and remove it off cleanly. Put the other one on the skin, and same thing. Put the other electrode, green, okay, and hold it. Nice. Once this is done, okay. Normally, the way I do it, I don't put this immediately, but you can follow your own practice. I normally prefer to put two and then directly go for the ears, because the minute you put this here, if the baby is a little awake, the baby starts moving. You start doing that, and it can get difficult. So leave it for the last. Even here, you can prepare the skin clean it up and keep it, but don't put it. Take the ear couplers. This, as you know, is hydrogel based. Okay. So yes, this is the left. So I will take the left one. Again, the flap is behind, right? So this goes behind the ear. So I will put it here on top, so it stays in place. Then I will, let me show this to you from that side. Okay. So I would try to part the baby's hair as much as possible on top, and I will close this here, and I will not again just keep it and leave it. Yeah, press start screen. Start screen. See, now you can see it's all green. So when it's all green, it's all connected well, impedance is less. Any of the sensor comes out, see, we'll say yeah, impedance is, yeah, because it's come out. Okay. Anyway, put it back. The display again remains the same. You can see two symbols, one of a bell, another of the small baby. The bell is the noise. If there's too much of noise in the room, then it may take a little longer time. The machine may wait till it settles down, then it starts screening. And the other one is the baby movement. If there's too much of movement on the baby, you can see this. So if the baby is moving again, the machine can't distinguish a lot of myogenic activity, right? So see that the room is significantly quieter. Baby is not moving too much. Once that is done, then you can see the two other regions. So this is red is right and blue is left. So this will keep updating. And just like the other machine, it will fill in and give you a pass or a refer. So if you do the procedure this way, spend some time, probably spend the 5 minutes here, then your screen will be just probably 1-2 minutes.